Welcome to The Explainer. So, what actually happens behind the scenes after a doctor takes your blood or, a tissue biopsy? Today, we're stepping into the world of the medical detective. We're decoding the foundations of pathology to see exactly how diseases are tracked down, understood, and ultimately defeated. I mean, really think about it. How do doctors actually solve the mystery of your illness? When you're sick, your body is essentially this microscopic crime scene. There's a culprit, a timeline of malicious events, and actual physical evidence left behind in your tissues. But to crack a case like that, well, you need a highly specialized investigator. Okay, let's dive into this. To understand how this whole investigation works, we've got to get our terms straight. The word pathology comes to us from ancient Greek. Pathos means suffering, and logos means study, so literally, it's the study of suffering. But scientifically speaking, it's the study of the structural and functional changes in your cells, tissues, and organs caused by disease. You can think of pathology as the ultimate bridge. It takes the basic medical sciences, the pure biology of how bodies work, and connects it directly to clinical medicine, the actual hands-on treatment of patients. So here's our investigative briefing for today. We'll be looking at 4 distinct phases. First, the medical detective. Then, the 4 pillars of disease. Third, from humors to cells. And finally, the modern pathology toolkit. Let's get into it. Section 1. The medical detective, deciphering the clues of disease. Every good investigation starts with initial clues, right? And in medicine, these are divided into 2 very distinct categories that often get mixed up. First, we have symptoms. Now, symptoms are entirely subjective. They're the complaints experienced internally by you, the patient. Things like pain, fatigue, or nausea. Stuff a doctor can't physically measure. Signs, on the other hand, are objective pieces of evidence. This is what the clinician can independently observe and measure. Think of fever on a thermometer, the yellowing of skin in jaundice, or physical swelling. And when you put those 2 together, they form a syndrome. That's the medical detective's first major lead in figuring out what's actually gone wrong. Moving on to Section 2, 4 pillars of disease, the investigative framework. Now, what's really interesting about this methodology is how structured it is. Just like any rigorous criminal investigation, studying a disease relies on a step-by-step framework. We call these the 4 pillars. First up is etiology. That's basically identifying the suspect or the root cause of the disease. And knowing the suspect leads us to pathogenesis, the crime timeline. This maps out the specific sequence of events, from the exact moment the cause first strikes to how the disease actually develops and progresses inside the body. Next, we have morphologic changes. This is your physical evidence, the literal structural alterations in the cells and tissues. And finally, clinical manifestations. These are the witness testimonies, the symptoms and signs we literally just talked about, which result directly from those functional derangements. This chronological flow right here, this is how every single disease is analyzed. So let's zoom in on that first pillar for a second, etiology. The suspects generally fall into 2 broad categories. On one hand, we've got genetic causes. Think of these as the inside jobs, hereditary defects, internal mutations, and chromosomal abnormalities that a person might actually be born with. On the other hand, we have acquired causes. These are the external threats, the injuries that attack the body from the outside, like viral infections, chemical injuries, or physical trauma. Figuring out whether a disease's etiology is genetic or acquired, that is absolutely crucial. It's step 1 in solving the case. All right, Section 3, from humors to cells, the historical evolution of pathology. Let's move on and see how this builds, because to really appreciate the modern framework, we have to look back. We went from ancient guesswork to precision science, and the leap is just fascinating. Back in ancient Greece, Hippocrates, who we all know as the father of medicine, introduced the humoral theory. And for centuries, this was the accepted medical truth. Fast forward to the Renaissance, and we meet Morgani. He became the father of pathologic anatomy by being the very first to correlate a patient's living symptoms with the actual physical lesions found in their organs postmortem. Huge breakthrough. But the massive, truly revolutionary leap happened in the 19th century, when a scientist named Rudolf Virchow established cellular pathology. And this brilliantly illustrates just how drastic that shift was. For literally hundreds of years under the humoral theory, doctors believed disease was just a simple imbalance of 4 body fluids: blood, phlegm, yellow bile, and black bile. So, if you were sick, your fluids were out of whack, which is why treatments like bloodletting were so common. Yikes, right? But the modern triumph of science, cellular pathology, completely flipped the script. It proved that disease doesn't start in abstract fluids, it fundamentally originates in the actual physical cells of your body. Which brings us to this foundational quote from Rudolf Virchow himself, omnis cellula e cellula. That translates to all cells come from cells. Virchow basically cemented the idea that cells are the fundamental units of disease. Every single pathological process, every illness, every disruption to your body's normal state ultimately comes down to structural and functional changes at the cellular level. I mean, this was a real game changer. It permanently altered how medical detectives operate forever. Bringing us to Section 4, the Modern Pathology Toolkit, solving the case today. So thanks to Virchow's cellular revelation, the field of pathology just exploded into all these specialized branches. The modern toolkit we use today is incredibly diverse, split between structural and non-structural specialties. We've got histopathology, which is the microscopic study of tissues to find cellular abnormalities. This is your classic biopsy. Then there's cytopathology, the study of individual exfoliated cells, kind of like what doctors look at during a pap smear. Hematology handles diseases of the blood, like leukemias. Microbiology hunts down the exact disease-causing microorganisms, bacteria, viruses, fungi, the whole shebang. And immunology focuses on abnormalities in the body's defense system itself, like autoimmune disorders. The investigation has gotten so incredibly specialized just to make sure we catch any possible culprit. But you know what the absolute cutting-edge frontier is right now? Molecular pathology. We aren't just looking at tissues or whole cells anymore. Nope. Molecular pathology studies disease down at the literal DNA level. Today's medical detectives use advanced molecular tools like PCR for precise cancer diagnoses, genetic testing, and ultimately personalized medicine. We can actually read the molecular fingerprints of a disease now, and that guides these incredibly targeted, life-saving therapies customized to a patient's exact genetic makeup. It's wild. So when we fit all these pieces together into a single, cohesive narrative, we get this, the entire conceptual flow of human health. Just look at the progression. We start in a state of normal health, which then gets disrupted by an etiologic cause. That triggers pathogenesis, the mechanism kicking into gear, which leads to cellular and tissue injury. Because of that injury, we see physical, morphologic changes. And since the tissue has physically changed, its function gets disturbed, which manifests clinically as the symptoms and signs that you actually feel. Finally, analyzing all of this step by step is what allows the medical detective to provide a diagnosis, a treatment, and a prognosis. The entire path from normal health all the way to healing is completely mapped out. It is just incredible to think about the complex, microscopic universe operating inside of us every single day. And the rigorous investigative science dedicated to keeping it running smoothly is nothing short of amazing. Pathology isn't just about diagnosing illness. It's about deeply understanding the suffering of the human body so we can actually alleviate it. So, next time you feel sick, I want you to ask yourself, what are your cells trying to tell you? Thanks for joining me on this explainer today. Keep learning, keep analyzing, and I'll catch you on the next one.